All right. Hello, everybody. I just want to welcome you to our July edition of the Wellness and Prevention Series sponsored by the Cancer Survivors Park Alliance. We will give it a couple more minutes to let some other people in, and then we will get started. All right, so it is 5:31, so let's go ahead and get started. I'll be your host tonight. For those of you who are regulars and used to Dr. Jager hosting, I will be filling in his absence. My name is Katie McClellan, and I am one of the nurse practitioners at Bon Secours St. Francis with the Cancer Center. I work alongside some really wonderful people within our cancer program in the medical oncology side of things. I'm also on the board of directors for the Cancer Survivors Park and am very, very excited to be here and helping host this. So just a couple things before we get started. Everybody will be on mute right now, but we welcome any kind of questions or comments. So just throw those into the chat box and I will be monitoring them throughout the presentation. And also this will be recorded, so we will have it uploaded on the Cancer Survivors Park website in just a couple of days, so you can check that out. So without further ado, I'll go ahead and introduce this month's topic and speaker. First, I just want to say I'm really excited about this topic. In particular, we're going to be focusing on the adolescent and young adult population. This is a very, very important population, just because, as you can imagine, being a younger person and then getting a life-changing diagnosis, there's a lot of psychosocial and other, special considerations that we have to address with this population. So I'm glad to be putting out some resources for this population. So I'm also really excited to introduce our speaker tonight, Mechelle Allen. So she works alongside me at Bon Secours St. Francis at the Cancer Center. And she's a wonderful asset to our young adult and adolescent population. And we're excited to have her here tonight. So I'll go ahead and just give you a little background on Mechelle. So Mechelle Allen is the AYA, which stands for Adolescent and Young Adult Life Specialist at the Bon Secours St. Francis Cancer Center. She obtained her Bachelor of Social Work at Johnson C. Smith University and shortly pursued her master's degree with a specialization in integrated healthcare at the University of Pittsburgh. She has experienced numerous opportunities that have allowed her to gain insight and knowledge within the profession of social work. Mechelle has served within the ministry of Bon Secours for 4 years, and she recently transitioned from St. Francis downtown as an inpatient case manager to our Cancer Center program. So her experiences consist of volunteer work with Sigma Gamma Rho Sorority Incorporated. She's also served as a peer educator with the Collegiate Health Improvement Project in Charlotte, North Carolina, a mental health professional camp with Camp Kesem, Clemson University chapter for children who have lost a parent to cancer or have a parent with cancer, and interning with a Child's Place, which specializes in working with homeless children. She finds inspiration in finding and helping those who are in need. So we are very, very excited to have her and obviously very knowledgeable about this very special population. So, Mechelle, without further ado, you can take it away.
Thank you, Katie, for that warm introduction. As she stated, my name is Mechelle Allen. I am the Adolescent and Young Adult Life Specialist at the St. Francis Cancer Center. Today, I will be discussing financial toxicity in adolescent and young adult patients. So before we get into the specifics of financial toxicity, I want to clearly define AYA with cancer. So when we're talking about adolescents and young adults within the US, that age range, is between 15 and 39. And what we know about this age group is the most fragile age group for financial toxicity. And because within the ages of 15 through 18, we know that a patient is classified as a dependent. We're looking at them having a parent or a loved one, far as a caregiver, to provide support in the transition of their illness, as well as with them seeking education, how this age group can be critical because they're entering into high school. As well as their parents being highly dependent upon them for financial support, as well as helping care for them. And then we also know within this particular age group, it may make them eligible for supportive programs that can help along their journey with encountering cancer. Also, specifically within the age group of 18 through 21, we now go towards the course of marital status, where patients may be entering to their phase in their future, far as seeking relationships, entering into higher education, far as college, learning their workforce, navigating what jobs may be of their interest, and also insurance. As we know, when you're within the 15 to 18 age group, you're still able to be under your parents' insurance, as well as through 18 to 21. But as you age out, those things are critical within this age group. So the objectives that I will be discussing today is: what is financial toxicity? Why is it important, as far as the relevancy to this particular age group? When to address it, how to assess for risk factors and barriers, and who can address these issues. So I wanted to take a walk in an example far as a particular patient's experience. So we have a 21-year-old female who was diagnosed with a carcinoid tumor. And this tumor was at the tip of her appendix. And this situation was pretty interesting because this patient was undergoing a procedure for a pre-existing condition. And throughout the procedure, a surgeon was emergently called in because the tumor was found throughout the initial procedure that was scheduled. And that tumor was pretty much latched on, which was causing significant discomfort to the patient. And so throughout the patient's hospitalization, it was not only prolonged with coming across the tumor during the initial procedure, but this patient went through a series of complications as far as remaining anemic. She had to undergo a hemocolectomy. Her dieting was challenged, so she therefore had to have an NG tube. But I bring these concerns up because this patient was on the high mark of her college courses, and she was preparing herself for graduation, which this had took place her junior year. So as you can imagine, you have a patient who is not only in the peak of their life where they're encountering different experiences, being in a new setting, far as a college or institution, as well as trying to prepare for graduation, and cancer comes into their life. And so with this particular experience, the young lady had experienced medical debt from utilizing different specialty services in reference to her follow-up care, as well as her surgical procedures. And as you can imagine, not only trying to think about whether or not she will be able to still graduate on time, whether she will have the means to cover her healthcare expenses, was a financial burden where she could not focus essentially on her healing. And I'm here to let you know that young lady is myself. So I bring this discussion to you because it is truly important to me And it speaks volume as to how a financial stressor can weigh on the physical body and be a hindrance to a patient completing their health course successfully. So let's go into what is financial toxicity. So JAMA Oncology defines financial toxicity as the harmful effect of high-cost treatment on a person's quality of life. So we're looking at the financial burden and the cost of care when a patient encounters cancer, specifically adolescents and young adults. So when we talk about the impact of financial toxicity, we're looking at what factors play with this concern. And one thing that we know, particularly within this age population, is it can cause non-adherence with treatment. And when I state that, I look at in the concerns of the patient may be unable to afford their prescriptions. They may miss medical appointments because they may not have insurance or adequate insurance that provides enough coverage for them to make their visits. They may not have reliable transportation or gas to come back and forth. And this is where your social worker or your supportive services come involved, because as we know, cancer patients can be eligible for supportive services that can help with gas mileage. So those things can not only cause a barrier to care, but also a challenge financially. We also know that the increase in medical debt. So when we're looking at the cost of pharmaceutical drugs, when we're looking at the cost of visits, whether it's through outpatient or inpatient hospitalizations, as we know, yes, if you have insurance, that may be a benefit to the patient, but consider a patient who is uninsured, taking all of that financial responsibility. Also within this particular age group, the inability to save, far as having savings for other life plans, but knowing that you may have to tap into those savings because of unexpected events. And also minimize access to affordable and quality health insurance coverage. So it's important that we talk about when to address financial toxicity. And it is critical because once the concern has been identified, we must address it head on. So the appropriate timeline is following diagnosis and treatment recommendations and ongoing. Because what we know is after the diagnosis has been given and after the patient has been arranged and set up for their treatment course, we then can look at the cost factors as to how much this will cost, far as from pharmaceuticals, far as whether it's chemo, radiation, immunotherapy, what does that look like for the patient? And we also know that finances can change. A patient can initially be employed full-time, and then as they encounter their diagnosis, their working status can change. So it's important that we assess those financial concerns ongoing and when appropriate. By doing this, we are able to early identify what barriers are at the forefront. We're able to know if they are employed, what benefits may the patient have available to them, whether it's short-term or long-term disability, whether it's family medical leave, whether they have a policy that can help provide coverage for health expenses. That is critical that we know in the beginning to avoid increased debt. Also assessing eligibility for supportive programs, state-run programs that patients may be eligible for depending on their age or the situation at hand. Also routine assessments, as I earlier stated, to identify what changes have occurred within their financial situation. So I had outlined a way of how do we treat financial toxicity. And before we can address any concerns, we have to ask the patient what obligations are given to you at this moment. What things do you have to be responsible for from a financial perspective? And once those things have been outlined, we then want to look at what are necessities, what are things that the patient cannot go without, what is important to the patient, because although they may encounter a cancer diagnosis, we know that life does not stop, that bills continue to accumulate. So starting with what the patient's responsibility is. Then moving forward to what insurance benefits the patient may have, knowing that their insurance policy and what plan they may elect in open enrollment is critical, because it then lets us know what services will be covered, what copay will be expected of the patient, what things will the patient be responsible for after insurance has provided their coverage. And then far as additional benefits and grants, we know that social workers, as well as other supportive roles, financial navigators, financial counselors, can identify what grants may be eligible for the patient depending on their diagnosis, disease specific, to know what funding may be available, as well as other supportive grants. And then we focus on healing, what the patient desires to have, the goal to be cancer-free. And what we want the patients to focus on is their healing course. We don't want a financial barrier to be at the forefront of their mind, even though we know from a human standpoint, that is a true concern. So I wanted to outline some risk factors as what can be important when we're looking at different components as far as the patient's age. Like I earlier stated in the presentation, what stage of their life are they at? In reference to also their decision-making capabilities. Do they have a parent that is assisting them with decision-making? Do they have a significant other or a spouse that may be dependent upon the patient? So the age is also critical. We're looking at the income. What is their household income? What amount of finances are they already receiving, and what things will be changed based off this diagnosis, whether if their work status change, whether if they're then classified for disability, where they're able to get a new income that may still be an adjustment, but still additional support. And then we also know, looking at their race and ethnicity, far as what resources may be available to them, what environment may they be coming from, to know what things may be needed along the way, as well as health insurance. The type of cancer, the severity, and the treatment influences the patient's risk for financial toxicity. So how do we address financial toxicity? So when we're looking at how to address, we want to utilize assessment tools. And assessment tools can assess the financial barriers. So when we have an assessment tool, we're then able to see what concerns are stated by the patient and they're specific. Consulting with a financial counselor and a benefit specialist to know what supportive services may be available, whether it's financial assistance through the hospital or the healthcare system, whether it is certain grants, like I stated, far as disease specific, that the patient can apply for, that their financial counselor can link them to, as well as providing adequate resources that meets the patient's needs. I have put an example of an assessment tool that assesses financial toxicity. This assessment tool was developed in conjunction with the University of Chicago, and it has recently added on a good amount of information, as well as different questions to assess financial toxicity. But it's important when we're using assessment tools that we're assessing the issue at hand. And today, with us talking about financial toxicity, these questions are specific to that topic. I put this image here because it takes a team effort. Within healthcare, we know that our professions, whether you're a doctor, a nurse, a social worker, a psychiatrist, we all play a part in the patient's care. And working alongside each other and working in an integrative approach, we know that communication is vital, because the doctor may be in a discussion with the patient and a financial concern may come up that the social worker may have not been informed of at that moment. So it's critical to work alongside a team and together to meet the patient's needs.
So Mechelle, can I just interrupt you real quick?
Yes.
So, I know as healthcare providers, a lot of us, kind of know our role, and we know how to address these things and our screening and doing our part. on the team. But what would you suggest for either a patient starting out or a survivor or what have you? Like, what would you suggest they ask their healthcare team, or who do they go to for these kinds of resources? Do you have like questions that you would recommend they start to ask, or how they kind of open that conversation with their care team?
That's a good question, nurse practitioner Katie. So what I would first suggest is after the patient has received their diagnosis, linking to a financial navigator. And I say that that is critical because we know with the financial navigator, not only are they able to assess their insurance benefits and see what coverage will be available to them, but also looking at what drugs or what treatment plan has been recommended by the physician, whether a prior authorization is needed for the treatment plan from their insurance provider, whether it is an uninsured patient that has no coverage at all and may be discouraged as to how they're going to proceed with the treatment plan with not having any health insurance. So I think the first step would be looking at what is going to be expected of the patient. And I think that it can be hard to navigate the insurance world, whether you know if you have the right plan, whether your plan is in network with the agency that you're seeking care at, whether it is something that the patient can afford. So linking to a financial navigator as well as a social worker, because the social worker can not only access the team and connect the patient to the appropriate department, but also establishing a rapport with the patient so that if issues come about unexpectedly, they know who to contact at the right time.
Yeah, and I would imagine that most, healthcare organizations, because I know at St. Francis, you're automatically linked up with a financial counselor as soon as you're doing your chemo education and that sort of thing. And I would imagine that most, healthcare institutions, they're doing that. But do you know of any like situation where someone would have to, go and find a financial counselor on their own? Is that something that's available, or is it pretty much just provided through most healthcare institutions?
I have gotten interesting stories throughout different experiences with working here thus far since April of this year. And every hospital or healthcare facility may not have the same services. So that is a good point, because if that service is not available, then we encourage the patient to not only advocate for their self, but speak to the needs that they have. And what I mean by that, as far as if this concern is a barrier to the patient's care, it needs to be addressed as soon as possible. So if that discussion is had at the time of the medical assistant, typically you can guarantee a social worker, not always, depending on availability with the staff, as well as what services are in place, or if they have a AYA program, whether it's a AYA life specialist, whether it's a case manager, just depending on the facility, the title can be different. But what I would advise is if a financial counselor or if a benefit specialist is not available, you do want to ask for a social worker. And if it is not in the realm of the social worker's obligation or duty to address that, then she can provide appropriate service linkage to the appropriate professional in that facility.
Awesome.
All right, so we're going to now go to the benefits of the Affordable Health Care Act. And this particular act was very beneficial to the adolescent and young adult population, because with the act coming about, dependent coverage was extended to the age 26. So when we look at this population for patients who may embark on their future endeavors going to college, it can be helpful for a patient to still be under their parents' insurance plan, because had that not been the case, they may not have an employer that has benefits to provide adequate insurance or any insurance coverage at all. So that was a benefit to this population, but also the elimination of the ability to deny coverage or charge more due to a pre-existing issue, a pre-existing condition. Because if you can imagine, if you're already going through a financial crisis of paying for healthcare needs, and if pre-existing conditions were then charged as well, you can imagine the amount of stress as well as feeling overwhelmed with medical debt accruing, as well as expanding eligibility for Medicaid. And as we know, Medicaid is an important factor because this population can then be eligible depending on their situation at hand, but having those benefits that they now didn't initially have. So I had posted this article. I had attended the Adolescent and Young Adult Global Congress Conference in California that had took place in June. And I thought this was a very interesting article because it talks about the cost of cancer in adolescents and young adults. And it was commissioned by Team Cancer America and performed by Delati Access Economics in 2021. And the purpose of this report was to estimate the costs incurred by adolescents and young adults after their cancer diagnosis in the US and over their life course. Although I won't get into the specifics of this article, I do encourage you all to read it at your free time to get further information on what it looks like for an adolescent to encounter cancer, whether they're actively working, whether they have now had to alter their work role or their ability to work in a workplace because of their physical mobility, because of their needs or their abilities that may have changed with coming across a cancer diagnosis. So I do strongly encourage you all to read this. The burden of financial toxicity can further limit social interactions and the ability to save for personal goals, such as purchasing a home, vacation planning, and education. And I felt the need to bring in or zone in on how this can affect the social interactions for an adolescent and young adult, because at this stage of life, we're looking to go into our future endeavors. We're looking at traveling. We may be looking at getting a home. And I say we because I do fit that age description. And as you can imagine, up and coming, you want to look towards those new adventures. But we know too, with financial toxicity within their cancer diagnosis, these things may be further delayed or no longer an option because of the debt accrued with their financial burden. So let's talk about the financial toxicity and quality of life. So what we know is this can increase the risk of anxiety and depression. And with mood being a prime factor, if a patient is not focused or if a patient cannot concentrate and take in the information that their healthcare team may be informing them of, they cannot be at their best. They cannot make clear decisions. They cannot be successful in their treatment course. We also know that this can bring poor physical health. Already thinking back to the concern, if this reoccurs or if this happens again, or if I happen to encounter a different type of diagnosis, what will my situation look like if I already feel overwhelmed with the financial responsibility in front of me? And also increasing symptoms and pain. So we'll now discuss employment and education. So as I had previously stated, it can cause an interruption in formal education. Taking an example as the previous story that I had provided about myself, a patient may be in the course of a new job or a new education experience as far as going into community college or a technical school, how this could now be altered because of encountering an illness like cancer. Also, they may have the experience of employment loss where they're not able to adequately work or uphold their position or do the job responsibilities that they were initially able to do, whether it's physical impairments, whether it's caused by memory, a change in their job status. the impact of treatment. If they're undergoing chemo or radiation, they may not feel the best to work adequately or uphold their responsibilities. So now we're looking at, do they have the ability to seek unemployment? Do they have the ability to file for disability? Do they have the ability to file for family medical leave without losing their employer or losing their income significantly?
All right, so Mechelle, I'm going to interrupt you one more time.
Yeah.
So we do have a question, and we're wondering, what the age range of the AYA patients is, and then is that standard across all care facilities?
So I have came into experience where even while attending the conference that I had stated in California, some programs I have seen it extended to 40, sometimes it may be 45. I really think it is based upon the facility, but within the US, it is defined as the age grade 15 through 39.
Okay. Yeah, and then one question I had was, we see this a lot, especially with, younger people, they're not retired, they're still expected to work, they're still expected to pay their bills, and that's obviously their source of income. They don't necessarily have savings from they can't tap into their 401k and that sort of thing. So, what are your recommendations on how a patient can try to work through their treatment, or are there any resources that they have or tips that they have to try to help them get back to work after they've completed their treatment?
So I do think it is a case-by-case situation or tailored to the individual, because depending on their line of work, sometimes a patient can have an employer or a manager per se that can make accommodations, whether it's if you stand up on your feet all day and now you are encountering side effects of feeling nauseous or feeling lightheaded, and you now have the ability to do a job that requires you to sit at a desk or to sit at a computer. So I do think it's based upon the patient's input, because it's what they're willing and capable to do. Also with the input of their physician to know, do they have any restrictions? Is there anything that they need to limit or interaction with to know for our safety measures, but also looking at what is available at their current job. And if accommodations cannot be made, then looking at what benefits does my employer provide from a financial standpoint. And then beyond that moment, if they do not have any employer benefits, is then a discussion too with what does their treatment course look like, whether it's a year out, whether this may be 2 years out, looking at the timeline, because dreams can change, plans can change, interests can change. You may walk into an initial diagnosis and have a passion for doing a job that at the end of your treatment course, you have no desire to do. So I think it's really tailored upon the individual.
Yeah, I was going to say, I know with our AYA program, and I'm sure other AYA programs are very similar, our goal is to keep the normalcy, not only just for social interactions and having your sense of purpose, but then also, the financial aspect of it. And so, as providers, I think it's important to have a provider who respects that and tries to help you through those things, like you said, with like work accommodations and working with the employer. To make sure that even if it is just kind of a part-time light duty, only a day or so a week, if your employer can accommodate that to maintain that.
Definitely. And you brought up a good point. You do want to normalize their experience as much as possible. Although we know that this is a life-changing event, we want to make sure the patient's needs are still being met. And you have some patients who say, I still want to work. I still have the ability. I feel fine. So I do think it aligns with what does their treatment course look like? What is the patient's preference? And then also the input of the physician as to what restrictions or things does the patient need to be mindful of if continuing to work. So I wanted to talk about the cost of fertility preservation. As we know, with this particular age group, this is a high topic. And I say that because I had looked at the statistics and only 47% of oncologists talk to their patients about preserving fertility before they start treatment. And I question myself as to why that may take place, and hearing different experiences. As we know, some patients may transfer their care from a facility, whether it's for relocation purposes, whether it's a preference to continue their care at another facility. If treatment is urgently needed, that conversation may be overlooked or may be missed. And I think it is very imperative that we look at the importance of this discussion, because when we're looking at adolescents and young adults between ages 15 through 39, the desire to have children is a high interest. And so with knowing that there are some states who are providing comprehensive coverage for fertility preservation, although we do understand and we do know that there's a lack of insurance coverage as well. So this is also an important topic that we need to address when working with this population. And this is where your healthcare professionals, whether it's a social worker, whether it's the physician, if your healthcare facility cannot provide that service, knowing what appropriate agencies or healthcare facilities are available to the patient to help with preservation. We also are starting to see legislative action taking place to help bring upon change so that this can hopefully have some type of coverage through their insurance. But we do know that treatments of childhood cancer, including chemotherapy, radiotherapy, as well as hematopoietic stem cell transplant, can affect future fertility.
Yeah, and I think this is great because, this is what the AYA programs do, and why AYA programs are so important is because, this is one of the first things that a lot of AYA providers address, because they know how important it is, and in terms of the patient's goals, into their survivorship and that sort of thing. So, again, this just speaks to the importance of, plugging into an AYA program and a facility that has those resources available. So that's excellent.
Absolutely. And I do challenge patients too as well, if that is something that you have an interest in, or if that is something that a concern, please do not be hesitant. Although I know that can be a concerning discussion, and it may be triggering to even think about the ability to whether or not you're able to conceive or preserve in any type of format. It is important that those conversations are had, because things can be addressed in the beginning that may not be an option further down the line. We also want to discuss the in vitro fertilization. This allows couples to experience pregnancy and birth together. Also, embryo donations can be obtained from couples who have already pretty much conserved and then having extra frozen embryos. Cost is typically attributed by the process to make the uterus ready to accept the embryo and having the embryo placed. So again, as you can imagine, it's really case by case as to what the costs look like. But again, we know that this is an important discussion when we're talking with adolescents and young adults. So I want to look at ways to improve. Now that we're aware of what is financial toxicity, how is this relevant to adolescents and young adults? What things can we do with knowing the information that has been provided today? And one thing that I want to stress the importance of is utilizing assessment tools, because if we are not assessing what needs the patients have, we do not know what services are needed or what service is appropriate for the patient. But utilizing assessment tools that can measure financial toxicity well. And completing these routine assessments, not just a one-time assessment, but over time, as their treatment course may change, or if their financial situation may change, or if they have limited support when they earlier on had more financial support. So looking at those things and being mindful as to how that can affect within the near future. As well as participating in political advocacy. We know that advocacy can not only bring about change, but also legislative change. So working with policymakers to help bring changes that are going to be permanent and ongoing that can be beneficial to our patients. Being knowledgeable of institutional and local resources, and I will get further into that, but depending on your county, depending on your state, you may be available to certain resources that may not be available to your counterparts. So I think it's important knowing what resources are available and taking advantage of those things to help with costs. And like I earlier said, it takes a team effort. So working alongside an interdisciplinary team from a patient-centered approach. So in conclusion, I want to outline financial toxicity can impact an adolescent and a young adult's quality of life, as we stated, within their mood, within their physical health, within their employment. We know that this can bring about change that may be beneficial to the patient and sometimes cannot. We also know the importance of having healthcare insurance. And if a patient does not have healthcare insurance, getting them connected to the right people to help navigate that process, knowing what insurance plan may be appropriate for the patient, knowing that this can not only take a load off the patient, but provide adherence to treatment because they now have additional assistance. And also taking into consideration a patient's cancer type. Every patient's story does not look the same. So we know that based on the individual's support, based on their disease, based on their treatment course, we know that all of these different factors can play a part in their financial input as well as their quality of life. So I wanted to go over some resources that along my journey as working as a social worker have been very beneficial. A lot of the counties that I have worked with have a local cancer society, but some counties, whether it is in a rural area or whether they just do not simply have a local cancer society, it's important to know about what resources from an institutional standpoint as well as locally, as I previously stated. So with the American Cancer Society, it provides information to patients and caregivers to help guide them along their survivorship journey. I've also have listed Family Reach, which is a financial supportive service that helps with families who have financial barriers attribute to the patient's cancer diagnosis. So I would encourage you all to look at Family Reach as a financial resource, as well as I talked about the importance with fertility preservation, this being another good resource to help provide education about fertility preservation, what laws are coming about in different states to help with this discussion, what things can the patient ask when they're meeting with their physicians to provide insight on what questions may be appropriate or what things to consider when going through your treatment course or initial diagnosis. I also have listed the Leukemia and Lymphoma Society, with this being a common cancer within the adolescent and young adult population. I think it is imperative to know of this resource as well. They do offer a lot of financial grants such as co-payment assistance, sometimes it's traveling grants. So that is another beneficial resource that I have utilized along working at the Cancer Center. Triage Cancer, which is an important resource as well because it provides legal and financial resources to cancer patients and caregivers who may have questions about the workforce or if their experience with their employer was not a good experience while encountering their diagnosis, that can be a good resource as well. And last but not least, the National Collegiate Cancer Foundation. As I discussed throughout this presentation, the importance of education and schooling, as well as college education. This is a scholarship program that can provide upcoming scholarships and how that can impact patients' education as well as their life. And I now have my references posted. My references have continued. And then feel free to take my contact information. I am available for any questions you may have. If you're in need of resources or would like further information, I am available. This is my work phone number as well as my work email.
Awesome. Thank you very much. That was very, very informative. And I hope that we've helped some people at least, shed light on this important topic, and that we've, gathered some information that can help someone out there. Because I know this is a huge topic for not just AYA patients, but, anyone who's undergoing cancer care. It can be very overwhelming. One of the things I know that we do a good job in cancer treatment and that sort of thing is identifying patients and bringing resources. But I think one of the most heartbreaking things that I could think of is you've finished your cancer treatment, you're entering into your survivorship period, and you now have a mountain of debt. And, I feel like a lot of the resources out there are for people who are on active treatment, the financial counselors and those kinds of things. And so, worst case scenario, someone didn't get plugged in with all of those people, or they did, and stuff happened and they still have a ton of debt. I mean, what do you suggest those people do to empower themselves? Are there resources that specifically of for cancer survivors, or things that they can do, themselves to try to help dig themselves out of the mountain that they have in front of them?
So I think that's a really good question. I do get that experience as well. Far as, like you said, after you have entered into your life phase following your cancer-free, being in remission, or however you may classify it, it can be still overwhelming because you still can have, unfortunately, the part to still receive bills, to still have ongoing other life stressors. And I think it is important for any profession within the line of supportive services, knowing resources outside of oncology. And the reason why I say that, because you are correct, depending on the organization or the agency, a lot of the eligibility can be based around active treatment or active initial diagnosis, or if they're still having routine follow-up care, if it's not a strong argument far as them having frequent visits, it can be challenging as to what resources are available. So I do think, of course, being acquainted with other resources within the area that the patient may reside in, but also still utilizing what grants may be available for survivorship. As we know, sometimes grant funding is not always based around active treatment or initial diagnosis. So I wouldn't get discouraged in reference to that, but also still utilizing financial assistance through healthcare systems. I think that is important, whether their term for that year has expired, still reapplying. Like I said, depending on their household income, if that has significantly changed, looking at what state programs that they may be eligible for, whether it's food stamps to help with food in the home, whether it's a community resource that is donate driven, or even through the state or anything like that. I think it's important to still be aware of other resources outside of oncology.
Absolutely. So feel free to drop any questions or comments into the chat box. But one of the comments we have in the chat box, which I think is an excellent point to talk about, is not just the costs associated with medical coverage and medical care, but finding, resources to think about, like day-to-day stuff, keeping the lights turned on, food, and that sort of thing. So I think that's a really good point. And I don't know if you have anything else to add to that, Mechelle, but I thought that was an excellent point, because a lot of times, you know, we think about, oh, like medicine and medical costs and that sort of thing, but then you still have the day to day. And if you're not eating and having, you know, the lights on, then, you know, you're not really living. So.
And I would add to that in reference to utility, just for example, some of the total ministries within like the Greenville County area, or services like Share. There are housing resources available that sometimes can provide housing vouchers, or if there's a pre-existing bill far as past due rent, utilizing those community resources to take a load off the financial concerns outside of their cancer care, as well as utilizing food pantries. As we know, more food pantries are coming about, and even organic food pantries. So most of the time, well, I won't say most of the time, depending on what area you may reside in, but food pantries sometimes are free. So that's a free service that can be available, and healthy food at that.
Yeah, that's awesome. So one question I did have, and I'm sorry that I'm ignorant to this, but so when the Affordable Care Act was expanded, so that allowed individuals up to the age of 26 to be eligible for Medicaid?
So for the Affordable Care Act, it basically extended to where if a patient was aged out, and now was pushed to 26. So instead of it being cut off at the initial age, and now brought on more years for them to be eligible for coverage under their parents' insurance.
Okay.
Classified as a dependent. But when we look at Medicaid, depending on their situation at hand, especially attributing their cancer diagnosis, we do know, depending on the situation, yes, they may be eligible for a managed or Medicaid plan. Yes, ma'am.
Okay. Okay. All right. Any other questions, or do you have anything else to say, Mechelle?
I am honored to be here to speak before you all in reference to financial toxicity. I do strongly encourage, when you're working with patients, whether you're a survivor, whether you're a physician, whatever your role or your identification far as attending this presentation today, I want to encourage you to consider what financial toxicity looks like for a patient who may have a new diagnosis, and how your role can be vital. What things now can you put in your mind at the forefront to help assist the patient in the best way possible?
Absolutely. I think that's great. And I'm sure, you know, as a lot of our survivors, you know, they probably have knowledge in this area, and can pass that along to, you know, other survivors or newcomers or what have you. So, all right. So I think we are ready to wrap this up. Just as a reminder, next month, August 10th at 5:30, we will be talking about postmenopausal health and cancer risk. We have Dr. Jonathan Bailey, a board certified OBGYN, who will be presenting on this topic. And we look forward to learning more about this very important topic. And obviously a lot of, you know, women who have gone through cancer treatment and have had menopausal concerns and that sort of thing. So I'm sure this is one that will be very, very helpful and very educational. So and so just as we usually do, want to end with some final thoughts. And a quote that I think speaks to this topic and essentially the entire wellness and prevention series that the Cancer Survivors Park Alliance puts on every month. And I hope that this information is empowering, especially to this population that we focused on. So I think it's appropriate to give a quote by L. Frank Baum, he's the author of the Oz series, and personally one of my favorite book series. And his quote is, "No thief, however skillful, can rob one of knowledge, and that is why knowledge is the best and safest treasure to acquire." All right, so thanks again for joining us, everybody. Have a good night.